We use the software tools in a computer graphics environment in order to produce high-resolution images that answer questions that really affect people's lives. If you have seen advanced CG movies, any place where they put an application into a video that does not exist, it's computer generated. All of those software programs we can use in CT to reconstruct a person's internal part. Instead of an artificial thing, we're using a physical, real structure, but we're using the same software platform. The software is not that difficult to use once you learn what the anatomy is and what the doctor's trying to learn about this person. As a CT technologist, you spend approximately 1/3 of your time directly hands-on talking with your patients. You will ask them about what's wrong, why they went to their doctor, what's hurting physically, getting this information from a patient, taking care of them. You do have to start IV lines and give them contrast material, contrast to drink or injected. It depends upon what we do for the exam. 1/3 of your time is spent doing paperwork. Am I doing the right thing on the right person? Is this what the doctor really wanted to do? You know, the whole goal of CT is to answer a question. You come to me with the doctor sends you to me with a problem, a question that he wants answered. It's my goal to answer that question. This field is changing so dramatically and rapidly that what we frequently find is that even professionals who are used to medicine and used to imaging, career people, do have no clue as to what these scanners are capable of. Unless somebody is back here and interacting with it, unless they actually see it, it's hard to believe what these things are capable of. In radiology is a very good career to get into. The fundamentals, the groundwork that you learn is also applicable if somebody wants to go on and become a doctorate in medicine, if you want to go into nursing, if any other career you choose, the education credits are transferable. Just because you take anatomy and physiology for the X-ray program doesn't mean the same courses aren't also applicable to any other field in medicine that requires it. So it is a very good groundwork to get into. And for the last 15 years that I'm aware of, radiology has been one of the top 10 as far as the job and career fields to get into, for job security and marketability and mobility, job stability. For the amount of work and the effort that you put into it, the returns are fairly immediate. You don't have to go to a 4, 6, or 8-year program. You begin within 2 years, and then you can move on to a career path from there. When I was originally deciding, back when I was in high school, I did not know what I really wanted to be. I did not have a career path in mind. I did not have a goal. What I did was I chose the sciences, the maths, chemistry, algebra, trig. The basic foundation that I learned in high school served me later when I actually joined the military and went to go to the school. The prerequisites that I had in high school were sufficient to get me into that program. Had I not been studying the maths, the sciences, the chemistries, I would never have been qualified to get into that program to begin with. The programs out there, because they're developmental, a lot of them, the students will actually be an interactive part of the future of the whole technology. Their feedback into the courses actually improve the courses that are used in the next class, because many of the programs that are in existence now were not in existence as little as 10 years ago. But what I like best about being a CT technologist is the effect that I have on other people's, that I care about my community and the people that come to me. There are 10, 20,000 people walking around today having a better life because I was a part of that healing process, that I made a difference. You know, if they can come to me and I can help answer a question, they can receive better care, better treatment, they can resolve issues, and lead a better life. We can in fact save lives just by knowing what we're doing at the beginning, getting accurate information so a doctor can make a good diagnosis, treat what's wrong with somebody, and they feel better about it.